You can follow along with me as we get going. My name is Kylie Jackson. I work with the Department of Healthcare Services Benefits Division and the Hearing Aid Coverage for Children program. And I have with me Dr. Stephen Kamuka. Would you like to introduce yourself?
Hi, good afternoon, everyone. I'm a board-certified otolaryngologist, fellowship-trained otologist, and I'm a senior medical policy consultant now with the Clinical Assurance Division at DHCS.
We're very, very glad to have Dr. Kamuka consulting with us on the Hearing Aid Coverage for Children program. I'm just going to pull up the presentation quickly for you so that you can see this. Okay. So today's presentation is, like I mentioned, the webinar for medical providers and hearing professionals, and we're doing a special deep dive today on provider manuals as a resource that's available for you all. So you'll see some fun screenshots and resources as we go through. You do also have, just as a bit of housekeeping, a question and answer session that should be available for you. If for any reason you have difficulty getting to that, you should have backup access to a chat. So we look forward to addressing any questions that you have. Feel free to pop those into the Q&A box as we go through the presentation, and then we'll kind of do an answer session at the end, and I'm sure that we'll find ways to incorporate provider manuals into those answers as well, so you know where to reference those as you move forward. Today's presentation, like I mentioned, is being recorded. It's going to be available online along with the slides from today's presentation on our HACCP events archive. We also have automated closed captions available through WebEx today. There's a little button that looks like the image on your screen that says show closed captions in the lower left corner of your WebEx webinar window. So if you'd like to use that feature, you can click that button. And then today's webinar, like we mentioned, has the Q&A at the end. So if we don't answer your questions as we go through the presentation, we will make sure to come back and get to them at the end. First thing I want to start off with is some very exciting news for HACCP. Specifically, we recently updated the HACCP provider manual to provide you the latest and greatest information on the Hearing Aid Coverage for Children program. So first up, we have the link for the new provider manual. It's also linked from the HACCP homepage. So if you go to dhcs.ca.gov/HACCP, it's under the announcements as the updated policy guidance. There's also a link there to the audiology and hearing aid related manuals more broadly, so that subsection of the provider manual directory, if that's helpful for you. The February 2025 update was mostly policy clarifications, and you'll see where that fits into the overall program design as we go through this presentation today. Just a brief overview of HACCP. The program started in July 2021. We had a big expansion at the beginning of 2023 that allowed HACCP to serve a broader segment of California's children and youth. So instead of serving up to 18 years old, we now serve up to 21st birthday. And instead of being limited to folks who did not have coverage for hearing aids or another HACCP covered benefit at all, we're now able to provide supplemental coverage as well for folks who have their coverage limited to $1,500 or less per year by their plan. So if you have health insurance plan that does include hearing aids, but just limits how much they're covered, you may still be eligible for supplemental coverage through HACCP. Much of what you see here and much of HACCP in general is based on Medi-Cal fee-for-service. So if you've worked with Medi-Cal before, there should be a lot of familiarity. A lot of that also overlaps with policies for California Children's Services, or CCS. So hopefully it's a bit like coming home if you're new to HACCP. As I mentioned, HACCP eligibility currently extends from birth up through 20 years of age, so until the month that an individual turns 21. It is limited to California residents. It's a state-only funded program, so we do serve California residents. There is no immigration status requirement or documentation on that side, however. Household income must be under 600% of the federal poverty level. And I actually have a chart on what those dollar numbers are this year that I'll show you in just a moment, because the federal poverty level guidelines do get updated each year. So we want to make sure that everybody's using the fullest, most expansive version, which is going to be the 2025 FPL guidelines. The individual must not already have comprehensive health coverage for hearing aids. So if you're eligible for Medi-Cal or enrolled in Medi-Cal, you're not going to need HACCP because you'll already be able to access all of those benefits through Medi-Cal. If you're enrolled in CCS for a hearing related condition, you similarly already have all of those benefits available through CCS. So you don't need that HACCP as a safety net. However, for children who are not eligible for Medi-Cal or enrolled in CCS for a hearing related condition, or if you're enrolled in CCS for an unrelated condition, but not eligible for hearing aid related SAR, you can still apply for HACCP, and that's primarily going to be relevant if you're either uninsured or if you are enrolled in a health plan that excludes hearing aids or limits annual coverage for hearing aids to $1,500 or less. And a lot of the time, the health plan explanation of coverage will be categorical. So it'll be hearing aid related benefits that counts. Enrollment does require a referral from a medical provider or hearing professional. So it can be the audiometrist who did their school-based hearing screening. That's fine. It can be their pediatrician. It can be any sort of referring medical provider or hearing professional. Or if the child already has a valid hearing aid prescription, they can use that instead of getting an additional referral. We do offer a referral form to make your life easier. But if you prefer to write up a referral letter for a patient, that's fine too. We just need to know who it's for. There's some specific criteria like the name, date of birth, who it's from, so your credentials, and then that it's on a recent date. So if you prefer to write up and sign a letter, that's fine. Otherwise, we make the form available just to spare the thinking through it process if it's easier to check a few boxes and sign. HACCP income eligibility. This is the chart that I promised. And so this also helps show the income range of eligibility. And I apologize that I'm going to go through this a bit quickly so that we can get to the deep dive components of this presentation as well, and kind of the more provider facing parts. But I wanted you to have this context because it's really important for your patients who might be eligible. So first we have the household size, including parents. And then for each of these household sizes, we have the Medi-Cal for Kids eligibility. So this is the maximum income threshold for statewide children 18 years of age or younger. And then CHIP is going to be a higher income level that applies in certain counties. So San Mateo, San Francisco, or Santa Clara County. These two columns together, depending on which county your patient is in, are going to be the maximum income that is eligible household-wide for Medi-Cal eligibility for kids 18 and under. So if your patient has a household income higher than this, so for most counties, that's going to be the Medi-Cal for Kids number, but is under the HACCP maximum income over here, that's going to be your sweet spot for income eligibility for HACCP. So if somebody applies to HACCP and they're already eligible for Medi-Cal, but maybe they didn't, and this is one that happens more often, maybe they didn't realize they were in a CHIP county and that, you know, they have a household of 3 and their income is $80,000 per year. So they assumed they weren't eligible for Medi-Cal because it's over the 70,000 cap. But it turns out it's under the $85,000 a year cap for Santa Clara County, and that's where they live. We're just going to let them know, hey, good news, you're actually eligible for a broader set of benefits than what HACCP can offer since we're hearing aids only. And we're going to direct you over to the county to assist you with getting you enrolled in that broader set of Medi-Cal benefits, Medi-Cal coverage. So even if somebody is not eligible for HACCP because their income is lower than the HACCP range, we're still going to help connect them with the coverage, okay? And largely from a provider side, it's going to be the same process because Medi-Cal fee-for-service and HACCP follow the same set of procedures. So we want to tie this into the provider manual side, right? So I'm going to show you this excerpt from the updated provider manual. Starts on page 1, goes on to page 2, talks about the eligibility requirements for a recipient for HACCP. So it's going to go through the same requirements that we just listed, right? Recipient must be under 21 years of age, reside in California, not eligible for Medi-Cal. That should all look really familiar from what we just discussed. But what I want to emphasize is down here, there's also a note. It says refer to the billing Medi-Cal after OHC section in the other health coverage or OHC manual section for information on requesting supplemental HACCP. So this is talking about when somebody is eligible for HACCP and they fall into this situation at that last bullet point, the top of page 2, that says recipient does not have other health coverage for hearing aids or has other health coverage with a coverage limit of $1,500 or less for hearing aids. That section where they have other health coverage and there's a coverage limit, that's where this is really going to come into play, because when somebody applies for HACCP, they're also telling us if they have another health coverage, right? They're going to say, yes, I have Kaiser, or I have whichever other plan, Western Advantage, whichever plan they have, that's going to get tracked in their meds profile, the same as for a Medi-Cal beneficiary. We're going to know who your existing coverage is through, if you have it, and what DHCS program you're registered in this case, HACCP. So this is going to come back to be really relevant when we get to the reimbursement discussion a little bit later in today's presentation. But I wanted to show you quickly kind of where you would find out that there's another set of resources you need to look at and how you get there. So we've got the link here. And like I said before, the slides are going to be posted to the HACCP events archive. So you'll be able to get all of this online. And I'll see if I can find a way to send it out through the email as well. But the provider manual, so it lists the eligibility criteria and it also includes this cross-reference to the other health coverage. But say I didn't have the link already. How would I find this? This happens a lot of the time, especially here if you see in the screen clip. For the most part, the provider manuals don't have links in them. They just have the title of the other section. So when you want to find a provider manual, you would go to the Medi-Cal provider's website and the publications section. And I have the link for you right here. And you're going to click manuals at the top if you're looking for manual specifically, but this also works if you're looking for a certain provider bulletin, or if you don't know what kind of publication you're looking for, you can just click all publications. You'll get more results, but that might be what you need. Searching for a manual, you're going to select manuals, and then you're going to enter either the title, the locator key, or a keyword in the search bar. So here you can see, I just typed OHC, because I already know that OHC is part of the title of that manual section. And so up came 2 provider manual sections that are going to be relevant. This is the second result, says other health coverage OHC. That's the one I'm looking for. But now I know there's another manual section too, where if what I'm looking for isn't in the OHC section, I can check out the OHC guidelines for billing section 2 and potentially find what I'm looking for there. Okay, so moving on with the HACCP part. HACCP covered benefits include a pretty broad range of hearing aid related benefits from evaluation to follow-up. So when you're looking at this, it's basically any of the Medi-Cal benefits that tie directly to hearing aids is the list that HACCP mimics. Now we have the specific list published for you in the HACCP provider manual, and I'm going to show you what that looks like in just a moment too. But HACCP's kind of categories that we cover are hearing aids themselves, so that it can include assistive listening devices or ALDs, as well as surface-worn bone conduction devices, or I'm sorry, bone conduction hearing devices or BCHDs. It would not include surgically implanted BCHDs, although those are covered through CCS and Medi-Cal, because they're not considered a hearing aid necessarily in the coverage categories. They're considered a surgical device. We also include medically necessary hearing aid accessories, medically necessary supplies like ear molds and hearing aid batteries, and then hearing aid related audiology and physician visits to make sure that we're providing that comprehensive care. So those are going to include both the pre-hearing aid dispensing appointments and the post-evaluation visits, the follow-ups to make sure that everything is programmed correctly, that it's still operating within the member's medical necessity and meeting their needs. Coverage determinations are based on medical necessity, and we'll talk a bit about that more in our authorization section. And there's no cap on HACCP covered benefits if medically necessary. There are, however, some caps on the amount that can be reimbursed for specific procedure codes. Covered benefits that are included in HACCP are paid by the Medi-Cal fee-for-service rate. We'll talk about that a bit more in the fee-for-service, in the reimbursement section of this, but just making sure that there's the distinction there. So HACCP covered benefits are covered in the provider manual, and I've just got a little excerpt here, and I apologize that the font is small, but I wanted to give you kind of an overview of what it looks like so you can recognize it when you're going through the provider manual. And this is just kind of the beginning of the section. But it's going to say the same information, and then it adds in some notes about relevant statutes in the California Business and Professions Code. You know, if the recipient is 16 years or younger, then the hearing aid must be dispensed by the recommendation of both a board-certified otolaryngologist specifically and a state-licensed audiologist within 6 months of the sale of the hearing aid. So making sure that, especially for dispensing hearing aids, if a recipient is 16 years or younger, that we have audiologists who are licensed to dispense doing that dispensing rather than non-audiologist hearing aid dispensers who may be eligible to dispense for our older members, 17 and up. Then we've got the additional information here about there's a hearing aid cap in Medi-Cal, and this is kind of related to the information here about not having a cap on HACCP limits. So Medi-Cal generally imposes an annual limit on hearing aid related benefits of $1,510 per recipient. However, children under 21 are exempt from this cap. As you may remember from the HACCP eligibility slides, HACCP's age limit is a child's 21st birthday or the month of their 21st birthday. So all of HACCP, unless it expands at some point in the future to extend beyond the 21st birthday, is included in that exemption from the $1,510 cap. So we don't have to worry about this part, but it's got additional information in case folks are interested in kind of how that fits into the broader picture. When we talk about the same categories that we just talked about, the hearing aids that are covered include ALDs, include BCHDs. We've got some additional details noted this round, and we really appreciate the advocates and providers who worked with us to help inform these updates too, that the hearing aid batteries that are reimbursable include both single-use and rechargeable batteries. And then this section is further towards the end of the provider manual. So I want to make sure that you know it's there if you're looking for it. You scroll down toward the end, and I can actually get you a page number here. It starts on page 6 of the Hearing Aid Coverage for Children Program Provider Manual. Is the section marked procedure codes. And it'll go into a list. So this first section is about BCHDs, but if you scroll on to the next page, it's got monaural and binaural hearing aids as well, and audiology services. It's going to show you for each covered benefit, the procedure code, the description, and then if there's any sort of authorization required or a frequency restriction. So for zinc air batteries, oops, all right, didn't mean to do that. So for zinc air batteries that you would use with a BCHD, per member, there's a maximum of 96 batteries per 12-month period per device. So if your patient is using 2 BCHDs, one on each side, then the maximum would be 192 total per year, because 96 batteries times 2. For L8692, to use this as an example, since this is our main procedure code for a surface-worn BCHD, which I apologize that the description for the national code is a bit wordier than this, but this is for surface-worn BCHDs. So it's per device, and it includes a headband or other means of external attachment. So that can be either the soft band, like the headband, or there are adhesive stickers that some folks use. Either way, that that first softband or the first set of stickers is included in the L8692. There is a TAR required. It's not really a surprise. We'll find out in a moment that TARs or treatment authorization requests are required for all hearing aids. But then it specifies the frequency restriction is 1 device allowed per ear or side every 5 years. So it tells you right there your replacement interval. If a certain device stops meeting an individual's needs sooner than the expected replacement cycle, there are ways to get an exemption for earlier replacement with a different device that will meet their updated needs. And we'll talk about that in a little bit too. Just want to let you know, not to panic. We understand needs can change in some situations. When your patient is going to enroll in HACCP, this is a little bit of a transition back into the mainstream of the program overview. They can apply online. We really recommend applying online. It's much faster. You don't have to wait for mail. It also allows your patients or their families to apply quickly and securely by uploading any of the attachments that are required. So their income, documentation for the year, their hearing aid prescription or referral for a hearing aid or hearing aid evaluation, or their existing health coverage. That could be their evidence of coverage. And if the plan EOC doesn't already list the member's name or enrollment ID on it, they would usually just attach a copy of their health plan ID as well, so that we can match up, yes, this is the EOC that corresponds to what this applicant is actually enrolled in right now. Eligibility is determined within 10 days from receipt of the complete application. Generally speaking, it's not just confirmed that quickly. It's actually, most members will get their welcome letter with their new HACCP ID number within that 10-day window. So the determination is actually only 2 or 3 days, plus a couple of days for mailing. Enrollment confirmation is sent by mail, so make sure to let folks know you use their correct mailing address when they fill out the application. That's how we're going to let them know. If for some reason an individual is not eligible for HACCP, like I mentioned earlier, for the most part, that's if they're actually eligible for a broader set of benefits through a different DHCS program. So we're going to connect them with the program that can help them best. If your patient is already established with you as a pediatric hearing aid provider, we want to make sure that they have the information here. And similarly for you, if you're already enrolled as a Medi-Cal fee-for-service provider, you're already eligible to be working with HACCP. We would really encourage you to visit the HACCP provider locator that I have linked at the top here. It's providerca.maximus.com. And there's a link at the bottom with a provider survey to create your listing or update your listing if you're already listed in the provider locator but need to provide a different phone number or something like that. You just fill out the survey again and we'll match it up and let you know if we've got any questions. The provider locator listing is optional, but it's highly encouraged because it makes it life so much easier for members and their families to find a provider who works with children specifically. One of the frustrations that we hear about from families and from community partners that are out there serving these families is that it's really hard to find a pediatric audiologist who can dispense their hearing aids. A lot of the audiologists they reach out to, if they just go off of, say, the fee-for-service Medi-Cal listing, don't necessarily work with children. They might be specializing in geriatrics, or they might just be used to working with adults and not have, the level of familiarity that I'm sure many of you have with working with really young children in particular, or children with more complex diagnoses. So if you are already Medi-Cal enrolled and not yet in the provider locator, please sign up for the provider locator. We would really appreciate it. And if you have any questions about that, please let us know so we can assist you with the process. If you are not already enrolled in Medi-Cal, there's an online process for that as well. And we've got the link here at the bottom of this slide to learn more and apply online to become a Medi-Cal provider. The treatment authorization request, or TAR, process is one that Medi-Cal and HACCP both use to support appropriate use of covered benefits. There are multiple pages of detailed information in the new provider manual about the TAR process and the specific requirements for different scenarios. I couldn't fit all of them on these slides, but I just want to highlight a couple of them for you so you know where to look. So there's a specific breakdown of what TAR documentation is required for new hearing aids, including surface form BCHDs. And that's one of the examples that we'll be able to see in a moment. But there's also a distinct list of documentation that would be required for replacement of lost, stolen, or irreparably damaged hearing aids. And there's a list in the situation that I mentioned before for what documents are required when you're replacing or requesting to replace old hearing aids that no longer meet the recipient's needs. So if you're to the expected replacement cycle already, you're just going to treat it like a new hearing aid request, like the basic list that we'll go over in a little bit. But if you haven't gotten to that time period yet, since this particular member's original hearing aids or current hearing aids were dispensed, and it's a sooner than expected change rather than a normal life expectancy of the device replacement interval, there's some different information that would be required to explain, basically what has changed about the member's needs and how is this different device going to meet them. Some benefits, like hearing aids, always require a TAR for medical necessity. Others might only require a TAR after a certain quantity. So ear molds are one example. And if you go in the provider manual under the procedure codes to V5264 for ear molds, you're going to see this in the frequency restrictions as well. And the ear molds up to 2 ear molds at a time and up to 4 ear molds total per year do not require a TAR. However, if you're dispensing more than 2 ear molds on the same day of service for some reason, less likely to happen, or more than 4 ear molds total per year for the same member, which happens quite a lot for younger children who grow quickly, then you need a TAR to exceed that threshold that didn't require a TAR. So in many scenarios, when you're requesting the initial hearing aid for a very young child, and you expect for their age and growth patterns, they're likely going to need 4 sets of binaural ear molds within this first year. You can just go ahead and set the 8 ear molds as another line item on your TAR and essentially build your own custom combination TAR to include any other services that you think might be needed within that same time period. DHCS does anticipate responding to most TARs within 30 days of receipt. I'm going to brag about Dr. Kamuka's team since he might not brag about himself, but they do such a great job of getting the TARs responded to much faster than this. If I see a TAR that is still under review after a week or two, it's unusual. For the most part, they're getting through these very quickly, and there's such a keen understanding that these are children and we want them to have that early intervention, and this is really important. And they do a great job of blowing the expected timelines out of the water. One time or one kind of exemption where things can take longer is if we don't get all the information we need right away. So please make sure that when you're submitting your TAR, and just like applying for coverage, we recommend submitting your TARs online. You can securely upload all of the documentation. Just make sure that you give us all of the documents that meet the requirements we'll go over for documentation. And Dr. Kamuka, if you want to jump in and say more on any of these, please go ahead.
Yeah, I would defer on that. Congratulations to Mariana and her team because they do all the work and they come to me only when they have problems, and that's almost never. So I want to extend my thanks to them as well.
Yeah, Mariana's team has really helped shape the program as well with a lot of the insights that they've gotten from, even if we get a TAR for something that's not yet a benefit, it can help inform, what we can expand the program to include. The expertise has really been critical for the program's growth and expansion. When a TAR is required, you can submit it for review either before or after rendering the service, but it must be approved prior to submitting the claim for reimbursement. And your claim needs to include the approved TAR number or TAR control number, TCN, you may see in your claim paperwork. One thing about submitting the TAR before or after, so this kind of fits into what I was mentioning about when you're submitting the TAR for the hearing aid itself, even if you don't dispense the hearing aid until after you get the TAR approval, you can feel free to add in those other like line items, even if those services haven't happened yet, if you expect them to be necessary for this patient. Perhaps you've done one set of audiometry testing and already and are including that, but you expect to need it repeated at certain intervals to ensure that the hearing aid continues to meet this patient's needs. Just go ahead and include all of those numbers or all of those units there so that we can make sure, you know, while you've got all the documentation there for the hearing aids, a lot of that can support those other requests for the same patients as well. And it makes your life simpler as well in facilitating the billing authorizations. Additionally, we mentioned specific documentation is required for new hearing aids, replacement of hearing aids under different kinds of conditions. Hearing aid repairs is another category. If it's a major hearing aid repair, I think it's over like $25 that you'd be billing for the repair. Go ahead and send it in as a TAR, just so we can make sure that there's no issue with the claim when it goes through. A little bit of explanation goes a long way. I did include also a screenshot, and I again acknowledge this is more for recognizing the overall layout of the page than for actually reading, because it is quite tiny font here as a screenshot. But this is a lot of the same information. So here in the first paragraph, it mentions right up front authorizations required for the purchase or trial period rental of hearing aids and for repairs that cost more than $25 per repair service. So that's the repair part that we just mentioned. Claims for individual repair services are not cumulative when determining the need for authorization. So it goes into greater depth on the same topics that we touched in the presentation here. As always, if you have a question on something, and it's not covered in the provider manual or you can't find it, go ahead and reach out to us so we can help you. We are absolutely here to help, and making sure that you have what you need so that these children can have what they need is really important to us as well. We talked about the purpose of TARs really being to make sure that what's being requested aligns with medical necessity. HACCP uses the same standard of medical necessity that applies to Medi-Cal children under 21. So the question that's being asked is whether the requested benefit corrects or ameliorates a defect or physical or mental illness or condition discovered through screening. Correct or ameliorate is a really broad standard. It's basically asking, does this improve the child's outcomes? Does this improve the child's experience in coping with whatever the situation is? Does this meet some of their needs, even if it doesn't meet every single need? Or more simply, is it truly relevant for their needs? We are often asked if there's a specific hearing loss threshold required in order to approve a hearing aid TAR for children. There's not. What we're looking for is measurable improvement of your patient's hearing, and it needs to be accompanied by documentation that shows the improvement in your clinical reasoning. So this can be with a traditional standard like booth testing and pure tone average, or you can use alternate non-booth testing where it's clinically appropriate, such as otoacoustic emissions and electroacoustic testing. If you have test results that measure comparable hearing or speech perception with and without the hearing aid, please share those. Attaching any of these that you have is a great way to speed up your TAR review, because it just shows the hard data that makes it an easy explanation. If you're relying on non-testing measures of improved hearing or speech perception, please be sure to clearly articulate your observations and your clinical reasoning, documenting how this helps your patient. Ultimately, HACCP is using state funds, taxpayer dollars, to pay for these benefits, pay for the program. We want to make sure that those are being used wisely. The same thing for Medi-Cal, right? So we are all on the side of making sure that kids have what they need to hear. We just need to have the paperwork to back up, yes, this is the appropriate benefit for this child. We're not just trying lots of things to see what works best. So explanations of medical necessity, we've just got a few examples. We need you to describe the benefits, right? So if you say the child appears to benefit, that's a little bit too vague to really be documentation that this particular benefit actually benefits this particular member. But you can solve that by showing us why you believe the child benefits from the device. So whether that's test results that you have that you can attach, whether it's a simple explanation, it can help us justify the expenditure as being a responsible use of those taxpayer dollars. Similarly, for trial and error, let's try it and see if it works. That's way too iffy. But if you explain your clinical reasoning why you believe the recommended approach is going to successfully benefit this child, that helps quite a lot. If ultimately the situation is truly uncertain, we may recommend additional testing or evaluation to kind of help ground, the hypothesis, I guess you could say otherwise, as why this is going to more likely than not assist this child and meet their needs. I mentioned that we recommend submitting your TAR online, so we call those e-TARs or electronic TARs. You can submit those through the Medi-Cal provider website. This is going to be the same link that I included earlier. If you're on the DHCS website already, you can click providers at the top, and it'll take you through to the Medi-Cal provider website as well. From the provider portal drop-down menu, you're going to log into transaction services. If you have any questions with the e-TAR process, or if you need any assistance, you can also call the Medi-Cal Telephone Service Center, or TSC, at the number on your screen. So it's 800-541-5555. The most important thing you can do when you're submitting an e-TAR for HACCP is to select the Hearing Aid Coverage for Children program, or HACCP special handling code, from the drop-down box on the patient information page. And we've got a screenshot of that for you right down here. If you don't use the special handling, your TAR is going to end up routed incorrectly, and it could result in a denial because it might go to somebody who doesn't understand the parameters of this program and what's allowable. We want to make sure it gets to Mariana's team so they can do their magic and help you get the authorization that you need to be able to help your patient. When you're submitting a paper TAR, we include this just in case, but again, submitting online is really the quickest, most efficient, cost-effective for everybody, and secure way of submitting a TAR. No risk of, HIPAA protected information getting lost in the mail. There's, no risk of, oh, we lost, or we accidentally left out a page and now we need to mail it separately and hope it gets matched up with the right other set of mailed paperwork. If that happens with an online TAR, we'll let you know, and you can just log back into the same TAR and add an extra attachment and resubmit it. Much simpler. There's no additional delay to match it up with the right original paperwork. It just is already there. However, if in a pinch you need to submit a paper TAR, your internet is down for an extended time, whatever the case may be, you do have the option of mailing in a paper TAR on the 50-1 form with all of the same required supporting documentation. Paper TARs should be mailed to the TAR Processing Center at PO Box 13029 in Sacramento. Since there's no drop-down box for a special handling code on a paper TAR, we request that you please clearly write HACCP in the medical justification section of the 50-1 form. This is the best we can do to make sure that your paper TAR is still routed appropriately to the HACCP review team. If you need TAR assistance on a paper TAR, you would still also call the Medi-Cal Telephone Service Center, or TSC, at 800-541-5555. We talked briefly about TAR supporting documentation and how it can vary depending on the situation. These are for new hearing aids. So that includes BCHDs. It includes if you're requesting a new set of hearing aids at the end of the expected life expectancy of the previous device, right? It's not an earlier than expected replacement. You just use the same set of documentation. So you're going to provide the hearing aid prescription that's been signed by an otolaryngologist for members 17 and up, or if no otolaryngologist is available in the community, it can also be signed by an attending physician. You're going to include the signed medical history and physical examination by an otolaryngologist. Those two are really the two pieces that come from an otolaryngologist. If it's been signed by somebody whose credential title is head and neck surgeon or ENT, we understand that, those are inclusive of the otolaryngology expertise that's required. That'll be accepted. If you send in a signed medical history and physical examination from the child's pediatrician that does not include, an otolaryngologist, supervising or something, and making sure that there's that head and neck exam, it's not going to pass muster. You're going to need to go back and get a signed medical history and physical examination by the otolaryngologist and attach that to the TAR in order for the TAR to be approved. Then there's another two pieces that may come from the dispensing audiologist, or if the child has already seen another audiologist before they came to you, it can be from a prior provider as well, but typically come from an audiologist. So those are the signed audiologic report and hearing aid evaluation and the specification of ear to be fitted. These don't need to be 4 separate files when you're uploading them with your ETAR. Sometimes they're combined, the hearing aid prescription in the same electronic record as the signed medical history and physical examination. That's fine. They just both have to be in there somewhere. Similarly, the signed audiologic report and hearing aid evaluation may include a specification of the ear or ears to be fitted. That's fine, as long as it's in there somewhere. We just need to make sure that these 4 components are in the documents that you provide. Again, most of the delays that I've seen with TAR approvals tend to be if we can't get the signed medical history and physical examination by an otolaryngologist for some reason, which is why we recommend that HACCP members, when they come to you for their first visit, bring all of these documents, if they already have them from a previous provider, with them. Because we understand it's difficult to chase these down too if it's from a provider who's not you. Wanted to go through some frequently asked questions regarding the authorization process and reimbursement. We're also in the process of publishing an updated list of frequently asked questions on the HACCP website. Those include questions from families and members, as well as questions from providers. So if you or your patients have questions, they may also be online. And I always encourage you to call us. We can absolutely help you find the resources. But if you're an introvert like me, there's also the solution. Does enrollment in HACCP and receipt of the HACCP ID card identification give implied authorization for hearing aids and services? So the answer is no. Enrollment and ID card reflect program acceptance, enrollment, right? But TAR approval is still required for hearing aids because they require a TAR, not just program enrollment. Is the authorization, so it's talking about the TAR approval here, tied to a particular center or like provider facility for all services? Or can a patient or family seek different services at different centers or different providers? If so, can families change providers? So this is a more common question if you're coming from the CCS side of things, where they use communication disorder centers that are tied to each service authorization request. In Medi-Cal and HACCP, the provider who submits the TAR and receives the TAR authorization must also be the provider to submit the claim. If a client or member changes providers, the new provider must submit a new TAR for any further hearing aids and supplies. That said, we certainly appreciate if you can let us know the original TAR number or who the provider was who would have submitted the original TAR. We understand California is a really big state and people move around. People find out that there's a different provider who's closer to them, what have you. So if you're in LA and your patient just moved down from San Francisco, their San Francisco provider already submitted a TAR and it got approved, but before they could dispense the hearing aids, patient moves down to LA and now they're getting established with you as their new audiologist. Okay, you can send a TAR in to us, say, here's the information. This was already approved under this TCN number or, from this San Francisco-based provider, but the patient has changed providers, and so we're going to be dispensing it instead now. That helps us a lot with streamlining that updated approval so that you have a TAR in your provider name, which is going to allow you to actually submit the claim as well. Because if there's a claim that comes through, even if it has a TCN, if that TCN ties back to a TAR from a different provider, the claim is going to get held up until there's a TAR from the billing provider. So make sure that if you're the provider who's billing, you're also the provider who has the authorization. Okay. Long description for hopefully a really easy process, because as soon as we've got that reference information from you, yes, this has already been approved. No, we're not duplicating dispensing. We're just changing who's going to do the dispensing. Great. That's a really easy approval. How should providers confirm benefits are active or that hearing aids have not already been provided by another vendor, rendering their patient ineligible for new hearing aids until current hearing aids reach their useful lifetime? So as far as whether benefits are active, providers should check AVES to confirm a patient's HACCP eligibility. Regarding whether hearing aids have already been dispensed, that's not so easy for you to check on your side, but you submit a TAR and we check that on our side, kind of like in the example about switching providers after a TAR has been approved. When you submit a TAR, if we see that the same member just had the same or a different hearing aid approved a few weeks before you submitted this one, okay, we don't even know if that TAR or if that hearing aid has been dispensed yet and fitted, or if it's still on its way from the manufacturer. But their needs have probably not changed that quickly to need a different kind of hearing aid or to need a replacement hearing aid so quickly. Some things up here, we've got some sort of duplication. And so then if you haven't already specified, yes, this was intentional, the patient is relocated or whatnot, you're going to get a question back from us, usually with your TAR deferred, saying, this has already been approved through a different provider. Like, do we need to deny it as a duplicate, or is there an explanation here? Will authorizations be issued as a group similar to CCS SCG04? So CCS uses service code groups, and service code group 4 is related to the communication disorder clinics, or CDCs, that I mentioned up in the question about particular centers who provide services. SCG04 includes a finite list of services that are always approved within service code group 04. It's expansive, but it's essentially a one-size-fits-all, like, let's catch everything under the umbrella approach. Medi-Cal is different, and HACCP in this case follows Medi-Cal, as with almost every policy we have. So we don't automatically incorporate umbrella approval for all of these related benefits. However, you can do multiple TAR line items within your ETAR or even within your paper TAR, like I mentioned earlier, where you essentially build your own service code group of, okay, these are the hearing aids they're going to need. These are the repeat tests that I anticipate needing to come through in addition to the ones that I already did. These are, the ear molds in excess of the 4 per year threshold that we believe are going to be needed. We think they're going to need 8 instead, so I'm going to put in a line item for 8 ear molds. Whatever the related services are that are covered by HACCP that you anticipate this patient's going to need within 12 months, feel free to just include those there so that we can approve them all for you at once with the same set of documentation instead of you needing to come back. HACCP reimburses providers for covered benefits in accordance with the Medi-Cal fee-for-service rates and reimbursement policies. More information is available at the rates webpage that we listed here. Many of the HACCP covered benefits are in fact not reimbursed at a flat rate. They are reimbursed at what's called by report, which means there's a calculation that gets used when you're going through and putting together your claim, and that's going to incorporate essentially things like what was the bill from the wholesale provider, plus a certain amount or up to a certain cap. So there are 3 different ways of calculating the potential by report reimbursement for most hearing aids, and those are specified in the provider manual section on hearing aid reimbursement. So we'll take a look at that in just a second as well. When a HACCP member has other health coverage for OHC, such as through a commercial health plan, providers must also bill the member's OHC before submitting a claim to HACCP, just like you would before submitting a claim to Medi-Cal fee-for-service. So earlier when we saw that note in the eligibility part, and it talked about, when a member already has another health plan, but they just limit the hearing aid benefits. Okay, this is where that comes back into play, because now we've got this excerpt from the OHC provider manual, and this is actually page 2. But the section here is billing Medi-Cal after OHC. That's exactly what was being referenced earlier in the HACCP eligibility requirements discussion about children with existing health coverage who are using HACCP as supplemental coverage for their hearing aids. So there are in-depth guidance that's in the OHC provider manual that's linked. And I know it's a bit tiny here on the slides, but the short version is you've got to bill the OHC first. And if they don't pay the full Medi-Cal allowable amount, then you can bill HACCP as a supplemental claim, and you're going to provide like a copy of either the denial letter from the original insurance, which might happen in cases where, say, your patient has insurance that you're out of network for, so they're not going to pay anything. That's fine. Denial letter will work. Okay, you went to their OHC, you got $0 of reimbursement. Great. That makes the math easy when we pay up to the full amount that Medi-Cal allows. But we basically, like I said, deduct whatever amount, if any, their OHC already paid from the Medi-Cal allowable amount, so that you get that supplemental reimbursement that goes beyond what their OHC paid. If, on the other hand, their OHC reimbursement is fantastic and generous and exceeds what taxpayer-funded plans can cover, then congratulations. You don't actually need to submit a supplemental claim to us because it already exceeded what the Medi-Cal rate was. But if they don't meet the Medi-Cal allowable amount, that's where you're going to still want to submit the supplemental claim. If they do pay part, then you'll send us the explanation of benefits that shows how much they did pay, so we know how much to deduct. In addition to the documentation you send us about how to calculate the Medi-Cal allowable amount. I've got a copy of the claim submission form for you as an example. This doesn't include the OHC component, but you just attach that. And then you do one line item for each service that was provided. I mentioned this already, but we do provide supporting guidance to families, asking them to bring the documents that you'll need for their TAR to their first appointment with you as an HACCP participating provider, in addition to their HACCP ID card and any health insurance cards if they have OHC, so that you have that information up front and you already know ahead of time, like, okay, do we need to submit a TAR and get authorization from OHC at the same time, make it more efficient, anything like that. I include some FAQs from members and families here, but I want to make sure we switch over to our Q&As as well. So most of these are things that we've already covered. If a child's already enrolled in CCS, that's amazing. Keep the CCS coverage. If they lose CCS eligibility, or if they're applying for CCS, but they're not sure whether they will be eligible for it, it's fine to apply for HACCP as well. When we go to enroll you in HACCP, if you've already been enrolled in CCS, we'll see it and make sure that we don't enroll you in a duplicate program. The CCS would override if you happen to be enrolled in HACCP first. We talked about the partial insurance coverage for hearing aids. You would bill the OHC first, and then they can go ahead. You can, as the provider, go ahead and submit a supplemental claim to us. We're not going to reimburse families directly, but it's always to the provider who's enrolled. Resources for them about finding their insurance plan's explanation of coverage as one of the documents they need to submit when they're applying to enroll in coverage. And then bone conduction hearing devices, we discussed that surface worn BCHDs are covered, whereas surgically implanted ones are not, but that BCHDs do require an approved TAR. You're never going to need to bill HACCP members or their families out of pocket for HACCP covered benefits. Balance billing is prohibited. just like with Medi-Cal. However, if there is partial coverage through a health insurance plan, you would bill their insurance first and then bill us. So our policy is that you can submit TARs before or after an appointment. This is another question we get about whether authorization is needed to see an HACCP participating audiologist. We don't require it, but different providers have different policies around whether they wait until a TAR has been approved, or which this other option actually makes it a lot more efficient for providers. You go ahead and see the patient first, do whatever testing is required, and then submit your TAR for any of the tests that require a TAR with the test results. Because then you don't need to explain why a test is going to be necessary. You just show the results, and it is apparent to us as well. Hey, this was a necessary test. Nice little shortcut for you. And then we mentioned earlier that if a child's application for HACCP enrollment is denied, we'll explain why, and we'll also connect them with other resources that may be applicable. I have the HACCP Help Center contact information here for you, as well as the HACCP webpage. So dhcs.ca.gov/HACCP is going to have links to all of the program information you could want, including the link over to the online application portal. It also has the contact information for the Help Center, and you can chat with us online in English or Spanish, including secure upload of documents. If, for example, your patient applied for HACCP but didn't yet have your referral and they need to add that, there's a chat feature that allows for secure upload of documents like that missing referral document. It can just be uploaded and we can connect it with the right application. So we are here to help in a variety of formats. Right now, I want to thank you for joining us, and I want to switch over to our Q&As so I can make sure that we've addressed any questions you have for us today. Oh, Mariana, we're really glad to have you on the team. And I see a message that you couldn't see the presentation, but I'm hoping that that did show up. However, I will look for a way to email out the presentation as well. Did anybody else have questions they wanted to add to the Q&A box? That we've got a little question in a square at the bottom right of your screen that says Q&A. If you'd like to enter any questions there, we'd be happy to stick around for a bit and answer them for you. Otherwise, we hope that this has been helpful and provided some additional navigation assistance, at least with where to get the most out of the provider manuals, both the HACCP provider manual and relevant Medi-Cal provider manuals. So I will stick around for a minute to watch the Q&A and see if there are any questions for us to answer. So going to take the opportunity here to share my screen and show you where you can get to the new hearing aid HACCP provider manual and the category of provider manuals from the Hearing Aid Coverage for Children program homepage, which is often one of the easier ways to do it. So hopefully you can see this now. But if you go to the HACCP homepage, that's dhcs.ca.gov/HACCP. Down here under announcements, we have new updated policy guidance for providers. We've got a link to the HACCP provider manual. So that's going to look like this, right? This is the special note that we talked about for what cross-references are going to look like to other provider manual sections. You can see we've got a lot of the information that we talked about today, but in greater detail. So criteria, what documentation is required for different types of TARs, different types of benefits, or when they're considered medically necessary. And then down to the procedure codes. And there's a list of every covered benefit that is currently included in HACCP. But we will update additional codes as they're added. So you may see future revisions of the HACCP provider manual, I'm sure. But we've added, where a TAR is always required for certain devices. So these are all hearing aids. Does that make sense? And where a TAR is required under certain conditions, like for the repair or modification of a hearing, a TAR is required for repairs that cost more than $25 per repair service, like we talked about earlier. There are certain types of benefits where the authorization notes also include specific documentation or circumstances where those will be approved. So for example, V5267 is a hearing aid or assistive listening device, supplies and accessories, not otherwise specified. So it's pretty broad. So we include, you need to specify a description of which supplier accessory is being requested on a separate line per item if you're requesting multiple different types of supplies or accessories within a single TAR, the quantity of each, some additional information so we know what we're approving. And then a note in case you're requesting it with regard to ALDs, the audio shoes or audio boots can be authorized separately or in connection with approval of FM receivers. That's one of the more complicated ones, but just to show, where there are details, we try to be really inclusive with them. So you've got all the information you need up front. Similarly, for hearing aid batteries, these are the replacement ones, not the ones that are included with the original hearing aid. But there's no TAR required. And then if there are distinctions for place of service that require a TAR or not, those are all noted. One allowed in each 6-month service for this particular assessment. So there should be a lot more really concrete information in this revision that we're very proud of. But if you see additional things that could be clearer, we'd be happy to, assist with covering those either in other resources or make sure that the next version of the provider manual encompasses those as well. We really, really appreciate that you all as the providers are the ones with the perspective that matters on whether this is helpful. And any feedback that you give us is very much appreciated and taken seriously. There's also a note here about the reimbursement rates. Link to the Medi-Cal rates webpage, since it's a webpage, but the cross-reference here for the provider manuals that are relevant are going to be just italicized. So we can use that same trick that we used earlier, right? And I'll show you this link too. We've got the link to the section of the Audiology and Hearing Aids Bulletin that announced the HACCP provider manual. It's going to take you to the same publications page on the Medi-Cal provider website. So then I could just click over to manuals from there and search for the manual name that was being cross-referenced. So this is the same process that we had screenshots of earlier. It pops up right here. And now I can see the information that was being referenced about how certain procedure codes are going to be reimbursed or how their reimbursement is going to be calculated in some situations. So you can see those here. And then there's a similar one for hearing aids, the billing codes and reimbursement rates that talks through how the maximum allowance is calculated. So for hearing aids, and these are monaural hearing aids, but just as an example, you're going to look at the lesser of the maximum allowed or the 1 unit wholesale cost plus $635. And that plus $635 includes the service costs of the dispensing audiologist to dispense, program, and fit that hearing aid for the particular patient, but also to provide those 6 follow-up services that are discussed in here as well. And then, or the billed amount, if for some reason you decide as a provider, that there's some reason you don't need that amount for the additional services. But these are kind of our key provider manuals that we cross-reference the most. If you have any questions on them, we're happy to help. You see when we get to the binaural hearing aids, the maximum allowable amount is higher. So is the audiologist service add-on amount that goes on to the 1 unit wholesale cost. So it gets really detailed for each specific provider procedure code that is covered. Let's stop the screen share, make sure that I get back in case there have been any additional questions. Thank you so much, Dr. Kamuka and team, for joining us. Really appreciate having you here.
Thank you too. Great presentation.
Thank you. Your team helped develop it.
Thanks.
And I actually not seeing any other questions from our providers who've joined us today. So if you think of anything and you just would like to speak about it one-on-one with us, please go ahead and let us know. We'll be happy to help. If we've already answered all of your questions, then we've done our job well today, and we'll make sure that we get this up and available for you in case you'd like to share it with any colleagues or anything as soon as possible. As always, it's been great sharing your lunch break with you, and we hope this has been helpful for you as well. Thank you very much.